Hello and welcome to this edition of Creighton in the Community. My name is Joyce Bunger and I'll be your host. I was reading an article in Newsweek last week called Grow Your Mind, the Truth About How to Boost the Brain's Performance. Today we're going to talk about the brain and how you can rebuild the brain and boost the brain. With me today is Dr. Sanjay Singh. He is Chairman of Neurology and a professor at Creighton University. Good morning.
Good morning.
In the news is the high-profile case of Gabrielle Gifford. And this morning, I was listening to the Today Show, and Dr. Snyderman said that she applauded the neurologists, one, because of their timeliness, and two, because of their honesty, that it's going to be baby steps. Before we talk about today's topic, which is epilepsy, let's talk a little bit about what happened.
Yeah, it's an unfortunate incident, but it's something that does happen, quite commonly around the world and around the country. It is devastating for anyone to be shot in the brain, and only about 10% or so people actually make it after that event. So this is certainly a miracle for her and her family and for all of us that she has made. She's doing so well. The critical part is the first 48 hours. If people survive the first 48 hours, then the chances are really good that they will survive. And so I think we're beyond that window in this particular case. Most of the information we have is from media reports, and so it is somewhat difficult to base everything on that. But from what we've heard, and let me use a model of the brain to describe that. Apparently she got hit in the back of the left side of her head, and then the bullet came out of the front of the left side of the head. And so it kind of spans one entire hemisphere of the brain. And back here you have the vision areas, and so they could potentially be damaged. And then this green thing here is the sensation part of your body, and that could be affected. And then you have the pink is the motor control area of your body, so there could be paralysis. And then it comes out of the front, which can lead to changes in personality and an ability to talk and speak and all of that. So clearly, from what we've heard, she is opening her eyes spontaneously, which in head trauma case or when you get head injury, that is an important sign, because the way we measure the severity of head injury is through a scale called Glasgow Coma Scale. And it has three parts to that scale. One part is, do you open your eyes spontaneously? So if she's opening her eyes spontaneously, that is a really good sign. Her brain has swelled up because of this injury, and so what they've done is they've taken a piece of the bone, the skull, out so that the brain can swell outside. Because if that bone is there, then the brain swells inside and pushes these structures here, which is your brain stem. And that is where your respiratory, your breathing center, and your heart centers are. So those are critical areas. So they've taken a piece of the bone out, which they will replace later when she has recovered. But that provides space for the brain to swell outside and not inside, where it can cause more harm, and especially to the brain stem and the blood vessels that supply blood to the brain stem. So as we've heard through the media, she's moving both sides, both arms and legs, and she's spontaneously opening her eyes. I think all of that are very good signs. Obviously, we are through the worst part of this, and now the question is recovery. There can be some problems in the future when someone has this sort of injury. One of them could be seizures, the other is infection, but she's in an ICU trauma care with neurosurgery and neurology there. And I think they will take care and make sure that she doesn't go through any of that.
Another high-profile case was the ABC news commentator Bob Woodruff, who was hit by shrapnel in 2006. Now he's returned to ABC and doing some commentary work. I went into his wife's blog, who said her wish for the Gifford family is patience, that Bob has returned and he has rebuilt his brain, so to speak, and reboost, but he's not the same as what he was. So I was intrigued. I imagine it had to do perhaps with the personality aspect of
the front of your brain has, if there's damage to the front of the brain, your personality changes, and we've known that for some time. But you know, the science of the brain has advanced most in the last 5 to 10 years. So we've gotten to know more about the brain in the last 5 to 10 years as opposed to the last 500 years. So there's almost a silent revolution that's ongoing in the science of the brain. You know, Bob suffered what we call traumatic brain injury or head injury in general terms. And about 1.7 million people in the country suffer from traumatic brain injury every year. There's a significant number of people who do not make it, but fortunately, about 1.5 million of those head injuries are actually mild. And you can be hit by shrapnel or by a gunshot, as we've discussed, but the most common cause of this is either automobile accidents or sports injuries. Those are the ones that cause the majority of traumatic head injuries. You know, it is really fortunate that Bob has made such good progress and is talking. That tells me that some of his vital areas were not affected, like your speech area and language area. Some of the other areas of the brain that are responsible for thinking and cognition, I think those were probably left intact. But the brain does have an amazing ability to heal itself. And we thought that the brain cells once formed, you cannot form new brain cells, and that is no longer true. We know that there are adult stem cells that are there in your brain and that have the ability to replace and create more brain cells. And so we're also looking and seeing how we can create new brain cells, and that can heal people with disorders and disease.
Well, let's talk about some of that. And let's turn our talk to some of the patients that you see in your practice in neurology.
So neurologists treat disorders of the brain, the spinal cord, and the nerves, and some disorders of the muscle. So all of those, any disorder or disease that affects the brain, spinal cord, nerves, and muscles comes under the purview of neurology. Some of those disorders are like stroke. Stroke's one disorder. And strokes generally of two types. One is where you have lack of blood supply that causes a part of the brain to die. So say if one of these blood vessels gets blocked, then the part of the brain that it supplies dies off, and that's a type of stroke. And that's the most common kind of stroke. There are new treatments for it, because if you can get to a hospital within 4.5 hours, then we can give you a medicine that will break up that clot and reestablish blood flow, and so that area does not die. So 4.5 hours is a critical time window. So if someone's having, and unfortunately people ignore these signs, if you become weak on one side, if you become numb on one side, if you're having double vision or dizziness, you should get to an emergency room sooner rather than later. The other type of stroke is where one of these blood vessels bursts, or an aneurysm.
That's an aneurysm.
Or an aneurysm bursts, and so you have bleeding in the brain, and that's the other kind of stroke. And it is interesting that, and somewhat unfortunate, that one person suffers from a stroke every 45 seconds in the United States. So it's the most important and the largest cause of morbidity or disability in the United States. #1 cause of disability in the United States. So it's a very important neurological condition, and this is treated by neurologists and sometimes in association with our colleagues, the neurosurgeons, especially if it's a bleed. But a lot of things can be done to prevent strokes. Lifestyle modifications, giving up smoking, controlling your blood pressure, exercising, all of those things can lessen your chances of stroke. So that's one major condition that we treat. Obviously, we can treat hundreds of conditions, but I'm just talking
about the major ones.
The other is epilepsy. And epilepsy is an electrical storm in your brain. And about 3.5 million people in the United States have epilepsy. About 20 to 25,000 people in Nebraska have epilepsy. What has happened in the world of epilepsy is that it is the one neurological condition where there are more treatments than any of the other types. So there are lots of drugs, lots of new drugs that are there. If drugs fail, then there's surgery. So if you can identify where a seizure is coming from and you can safely cut that region out, then that's epilepsy surgery. Or the third FDA-approved treatment is a vagal nerve stimulator. It's like a pacemaker of your brain. So you put a pacemaking device here, and you put 2 leads in the neck, and then it buzzes for about 30 seconds every 5 minutes or so. And that's an approved form of treatment for epilepsy and seizures, too.
Let me ask you something. A woman that I know has Parkinson's disease, and she just had a mechanism put in. Is it a similar type of something that does something to reboot the brain?
It is similar. In Parkinson's, what's happening is that your one chemical in your brain called dopamine, that is not in quantities that it needs to be, so it's less than before. And that causes the body and to be rigid, have tremors, those sorts of things happen in Parkinson's. And so the first treatment is always medical. You give them drugs that bump up this chemical dopamine, and so they start moving better. But there comes a time when when the cells forming dopamine, this chemical in your brain, the cells have died off. So there is none to really augment now. In some of those advanced cases, what you do is you put in a deep brain stimulator. So you put in a stimulator wires in the depths of your brain, and then they are connected to this pacemaker in your chest. And that, because of its stimulation of the brain, can actually do away with tremor. So you could have someone having a tremor and you switch on the stimulator and the tremor goes away. So that's another new form of treatment for Parkinson's disease. And so I'm guessing that that's what she does have.
And just, we'll go back to epilepsy here in a minute, but Parkinson's, is that also something then you have patients with Parkinson's?
Yes.
And that's a neurological.
That's a neurological thing, and that is something that we treat too. So neurologists treat Parkinson's, treat stroke, we treat epilepsy, we treat dementia, Alzheimer's dementia, and all the conditions like multiple sclerosis that is there, all the nerve disorders, the neuropathies, spinal cord problems, all of these are treated by neurologists. This is all, any problems with the brain, the spinal cord, the nerves, and the muscles are under the purview of a neurologist.
See, I think you think of neurology as just the brain. You don't think of all the parts that go with it. All right, I regress. Let's go back to epilepsy, but it just spurred me to go, I wonder if that's what it is. Okay, so this mechanism you put in for epilepsy, and what does that do?
It's called the vagal nerve stimulator, and what it does is that it stimulates your vagus nerve, and that stimulation is carried back into your brain, and that prevents seizures from happening. Seizures are essentially, your brain cells talk to one another by electrical discharges. So there's electricity happening there. When you have an abnormal electrical discharge or a mini electrical storm, that's seizure. Anything that can break that electrical storm, that's treatment. So when you give drugs, they calm those currents down. They don't let those abnormal currents or the storm get strong enough to cause a seizure. So that's what the drugs essentially do. Now, if the drugs are not being able to calm it down, then if you identify a region where that storm is arising from because of abnormality, and if it is safe to cut that region out, then we can cut that part out. And that's epilepsy surgery. And patients go through that too. The third is this vagal nerve stimulator that I talked about. But there are lots of new treatments that are just on the anvil right now. There is the deep brain stimulator that I talked about for Parkinson's. It has finished its last trials for epilepsy, and it is showing benefits. So the FDA is looking at it, and we are waiting to get the FDA mandate before we start using it. There's also a fascinating new way of treating epilepsy where you find out where the seizure is coming from. You put an electrical lead there, and you connect it to a computer. And the computer is monitoring the waves coming from there. And as soon as it detects that a seizure has started, it stimulates that region, shocks it, and stops the seizure. And it's all happening without you ever knowing about it. So lots of new treatments that are on the anvil. Another exciting tool that is being studied is a transcranial magnetic stimulator. So it's like a wand which magnetically either stimulates or inhibits. So it either excites or stops the functioning of areas of the brain. So if you do it at certain frequencies right from outside, there's no drug involved, no surgery, just non-invasive magnetic impulses, they have the potential of treating epilepsy too. So the plan there is that they would come in once every 3 to 6 weeks, get the stimulation done with this transcranial magnetic stimulator, this wand on the outside, and that would help them decrease their number of seizures. So lots of new treatments that are on the anvil.
You mentioned in Nebraska there are 25,000 cases of epilepsy. As I was preparing for the show, I was trying to think of the people I knew that had epilepsy, and I only came up with 2. Is it a disease that people are just keeping quiet about, or is it a case that they're being effectively medicated so that it's not apparent?
A little bit of both. I think in years gone by, I would say 30, 40 years ago, people did not openly talk about their family members who had epilepsy. And so yes, there's some of that. Fortunately, with a lot of education and awareness, that has gone away, or at least has gone away to a large degree here in the United States. The other is, yes, there are really good treatments for epilepsy. So you have a significant number of people who are now seizure-free. And so people who are seizure-free go on to live very normal lives. And about 60 to 70% of people become seizure-free. And so those people...
Meaning it only happened at one point in their
Yes.
life, and it's all over now.
It's all over now, and for a period of several years, they have never had a seizure.
My.
And so they go on to live very normal lives. And even those who are having infrequent seizures, if they're well controlled, they can still go on to live very normal lives. In fact, some of the most successful people in history have had epilepsy.
Such as?
Such as Julius Caesar, Alexander, Van Gogh, Da Vinci, a lot of these most successful people in history have had seizures, and some very successful people in the current times have epilepsy and seizures. And so once these seizures are controlled, people go on to live very, very normal lives.
Is there some epilepsy that is not able to be cured? Are there some extreme cases?
There are about 10 to 20% of cases of epilepsy which are not responding to current treatments, and that is why we are looking for brand new treatments, as I talked about. And that because 10 to 20% would be between 300 to 600,000 people in the country. And so clearly that is where a lot of research is being done to find new cures. It's also important to get your epilepsy and seizures under control, because there is this entity called SUDEP, which is sudden unexpected death in epilepsy. And so it happens more often in people whose seizures are not under good control. So it is important to get your seizures under good control and go to a doctor that specializes in it and try out all the possible treatments that are there. Because unfortunately, research has shown that it takes people 10 years to try 2 drugs to establish that. And it should never take that long, because we have 14 to 16 drugs now that are available, and there are so many other treatment options that no one should have to just wait on 2 drugs and keep having seizures.
There's a little child down the street from me who had a seizure last week, and I was visiting with his grandmother, and the grandmother said, "Oh, it was nothing. He'd had a shot that day and it was nothing." Seizures are something.
Seizures are something. That means that there was an electrical storm in the brain. Now, if someone's had one seizure without any tests, what is their chances of having a second one? And that number would be about 30–35%. Okay? So yes, majority of people will not have a second one, fortunately. But that seizure does need to be evaluated.
Yes.
Every seizure patient should have brain imaging, preferably an MRI, and an EEG, which is a brainwave test that tells you if there is a tendency to have seizures. Because if these tests are abnormal, the chances of having a second one go up significantly higher. And so if you have abnormal findings in this, your physician might then decide to actually treat this single seizure. So it is very important to get them properly evaluated with their physicians and should not be ignored.
Let's spend our last couple of minutes talking about the neuro center that's being built at the hospital, Creighton University Medical Center. I know that changes in lifestyle are often apparent with a neurological disease. I was intrigued that I believe you share some space with the orthopedic area.
Yes.
And tell me about that. Why would you share space with orthopedics?
So yeah, let me tell you a little bit about the Neuro Center. At Creighton, we are developing a brand new floor of caring which will be dedicated towards neurological disorders. We are also building a brand new neurology clinic, which is going to just deal with patients with neurological disorders. And we're also renovating the department where a lot of our faculty and staff and research is going to happen. So we are really building things brand new, and everything should be done by May or June of this year. So it is a very exciting time. And it tells us that Creighton has put a lot of stock in treating patients with neurological disorders. And this is something that is really significant in the field of neurology and neuroscience as a whole. What is the reason that we are sharing some of this space and resources with orthopedics? Because patients with orthopedic disorders and neurological disorders have some similar needs. They may be immobile. If you've had a stroke and you're paralyzed, you're not able to walk and move as you should. If you've had a fracture of your leg, you're not able to move. So both of these patients would need a lot of help from physical therapists, occupational therapists. And so as we are building the new neurology, neuroscience floor, what we are doing is that we have the rehab center right there on the floor so that the patients are not being wheeled to great distances to get these therapies. It's right there, right next to them. The whole neurological setup, in the whole neurological center with the outpatient, the inpatient, and the departments all contiguous with one another. So it's a remarkable new thing that's happening at Creighton. And it really speaks volumes of Creighton's investment and Creighton's dedication towards treatment of neurological disorders.
It occurred to me that it's sometimes a disease, sometimes referred to as a disorder, and sometimes referred to as a condition. What is the difference between a neurological disease, a neurological condition, and a neurological disorder?
So epilepsy should be correctly referred to as a disorder. Parkinson's should be correctly referred to as a disease. And the reason for that is that Parkinson's, there is a specific problem in the brain where the dopamine cells are dying off, and that is the single process that causes Parkinson's, and that is why it is called a disease. Single problem causing a single effect like Parkinson's. Whereas epilepsy is a disorder. Why? Because several diseases cause epilepsy. If you have a brain tumor, that will cause epilepsy. Head trauma damage, that will cause epilepsy. If you have malformation of the brain, that will cause. So several diseases are leading to epilepsy, and that's why it's called a disorder. So the correct terminology would be epilepsy is a disorder, Parkinson's is a disease. Some people ask about what's the difference between seizure and epilepsy. I have a seizure, but I don't have epilepsy. Anyone who has 2 or more unprovoked seizures, by unprovoked I mean not under the influence of drugs or alcohol, so more than 2 unprovoked seizures qualifies for the definition of epilepsy. So epilepsy is a chronic seizure disorder. So if you've had just 1 seizure, you have seizures. If you've had more than 2 or more seizures, you have epilepsy.
Thank you. And when we return, we will talk with a young woman who leads a support group for patients with epilepsy. Today is Heather Overton, who manages the support group that is run at Creighton University, or managed at Creighton University. Heather, tell me a little bit about yourself and when you were diagnosed with epilepsy.
I was diagnosed with epilepsy when I was 18 months old. I don't really remember my first diagnosis being so young. My parents, of course, had to go through that whole process. The initial diagnosis was of febrile seizures, which is caused by high fever. And yes, it was a long journey because it wasn't just that one seizure. They progressed into a multitude of different types of seizures.
Let's talk a little bit about how your life was changed because of epilepsy.
How it's changed?
How was it changed? How was it different than other children?
What is normal? This is my normal, and I don't think I had a different childhood than anybody else.
What myths would you like to dispel about individuals with epilepsy?
That a person with epilepsy can be normal, that it didn't hold me back from being like any other little girl or a teenager or an adult woman. You know, do things that you want to do. Don't live your life in fear because you're always gonna, I might have a seizure, I might have a seizure. Don't live your life in fear.
Talk about your support groups. What happens in your support groups?
Our support groups meet the third Tuesday of every month, and my mother and I started that back in 2004. That's an eternity ago. And it's just a group of persons with epilepsy, caregivers.
And caregivers.
And family members, even caseworkers, you know, doctors sometimes want to come. Whomever wants to come and join and talk about their epilepsy. We have topics every month to discuss. We bring in people to discuss different things. So,
what spurred you to start it, you and your mother, to start this in 2004?
Well, my mom's the one that really wanted to start it, and it was because, and I got behind her, but it was because as the mother having a child, she didn't have anybody to talk to, and I didn't know anybody that had epilepsy my whole life. And so that was the real reason.
How can someone learn more about your support group?
With our email and phone number. I also have a Facebook page, the Nebraska Epilepsy Support Group, and it's also on the Creighton's website. And so there's multiple ways.
Well, thank you for what you do, and we wish you well. And thank you for joining us today. I learned a great deal, and I hope you did as well. On behalf of all of us at Creighton, thanks for watching.